Hi, I'm Dr. Pompa. If you've clicked on chiropractic, you're either a new patient or someone looking for a new chiropractor, perhaps. And because we do such different chiropractic here in this office, I feel definitely I owe you some explanation. There is a difference between just regular chiropractic and something called structural correction. I'm more like an orthodontist than a regular dentist, meaning that I deal with the structure of your spine just like an orthodontist deals with the structure of your teeth. But yet I still do regular dentistry, meaning that I still do regular chiropractic as well. But the difference in structural correction is really big difference because it really gives you a long-term benefit, and it has a really big benefit to something called the autonomic nerve system. And what is that? Well, most of you probably that clicked on this, you have some type of pain. And by the way, if you haven't watched the videos on neck pain or low back pain or discs or herniations, definitely watch those. But most of you probably have some type of pain. But look, 6% of the nerves in the body run pain. 94% of the nerves in the body actually run function. What do I mean by that? Well, look, your brain sends signals down your spinal cord and out these nerves, and it tells every one of these organ systems what to do. Your heart, your lungs, if I took this one nerve right here going to your heart and lungs and I squeezed it with a pair of pliers, you would actually have no pain. However, it would cause dysfunction, obviously in the organ group, and also the interference from your brain to your heart and lungs. There would be great interference there. So when we see structural problems with the spine, we know from literature and the research that it causes a really big disturbance in this autonomic nerve system, meaning that nerve system that doesn't run pain, but it runs function. So what I'm saying is, it's not my opinion, but what the studies show is that when you have spinal misalignments, especially those affecting your posture or the structure of your spine, it affects your all-around health. Now look, I want every one of my patients to get out of pain. However, remember, that's about 6% of the nerves. If you have pain, you're probably interfering with the 94% of the nerves that run function and therefore health. So what I want to do now is I actually want to show you an x-ray, a couple of x-rays before and afters of the work that we do. And I actually want to take you around the clinic and show you some of the things as well, because I want you to really feel comfortable when you come in and really have a good idea of what we do and why what we do is so different and why it actually works. So let's cut. I'm going to go to the x-ray and we'll show you what that looks like. I want to show you an actual x-ray of some before and afters. The one thing I always say is, look, when you go to your chiropractor, they may say they fix structure, but yet they never take a post x-ray. So if your chiropractor or the chiropractor you're looking for says oh yeah, we fix structure in this office, ask them if they take a post x-ray and demand to see it. In this office, we always take a post x-ray. Now, this is a case here. I want to show you what normal is first. I think that'll help. So focus in on this x-ray. From the side, when you x-ray a patient from this way, the neck should have a curve between 35 and 45 degrees. This bone should be about 30 degrees. See, when you move away from that normal structure, you have major problems that occur. Biomechanically, matter of fact, these muscles that run down your neck and in the middle of your back have to work 10 times as hard when you lose the curve. So guess what? You end up with pain between your shoulder blades, perhaps pain in the neck. But again, more importantly, when this neck straightens out, you stretch the spinal cord. And when you stretch the spinal cord, there's a medical term called tethering that occurs. When you tether the spinal cord, now you're affecting your health, and you're affecting a lot of other problems. I mean, it can be anywhere from headaches to digestion problems, things that you would never relate to the fact that you have pain or the fact you have a neck problem. Now here's the thing that I have to tell everybody. Look, by the time someone walks in my office in pain, they probably had a structural problem that has been there for 10, 20, maybe even 30 years. So I look at the x-ray and I say, Mary, your problem started 20 years ago. And I hear the same thing all the time. Dr. Pompa, that's impossible. My neck pain started last week. And I say, well, the pain may have started last week, but the misalignments started years ago. It's like driving around with your car wheels out of alignment. They wear down, they wear, and then eventually you come to the mechanic and he says you need new tires. Well, if he's a good mechanic, he'll not only want to give you new tires, he'll actually want to fix what? The actual misalignment. See, that's the key to fixing those biomechanical structural problems that cause chronic pain over your life, over and over again. Now look, there's also a bigger component to this, the health component. Here's a patient, now they've lost that curve. This patient actually came in with migraine headaches. Obviously there was some neck pain involved. and we brought this patient from this. I hope you can see this here, but there was no curve at all, and now you're looking at a really nice curve. This top bone that I said needed to be 30 degrees, it was about right here, and now it's normal again. We were able to demonstrate that change to the patient. More important to the patient, we were able to demonstrate a massive difference, not only in her pain level, her headaches, but in her health in general. This is structural correction. This is only one of the structures that we look at. We use a really neat weighting system in the office. How we fix it, the old days of like traction, I draw the analogy in the beginning of orthodontistry where it was force over time. Now we use something called neuromuscular reeducation. Big word, what does it mean? We re-educate the nerves and the muscles into a different position. So let me take you and show you a little look at that, and I think that'll give you a really good idea of what we do. So this is one of the ways that we correct spines. Because I showed you the cervical x-ray, that's the one that we're doing here, you notice that we actually have the weight on the front of the head. And really what happens is the body automatically forces back, and it forces that normal curve in the neck. All we're doing with this is causing a frequency. The frequency matches the same frequency as the spine, and it causes that neuromuscular reeducation I was talking about. Nerve, muscle, and we're re-educating them. You know what the best part about this is? Painless. The old days, stretching ligaments, those days are over. We have advanced. But really, it's painless. Between this and specific adjustments, this is one of the ways we correct spines. And again, when you correct a spine, you're getting a lasting change. You can adjust someone 1,000 times, you're not going to ever fix the spine. This patient here, I'll be able to take a post x-ray on and be able to show the patient, here's where you were, here's where you are now. That's true chiropractic, and that's definitely true change.